Carpal tunnel syndrome is a very common condition that I see in my clinic. It can be caused by simple things that are reversible, but it's usually due to a compression of the median nerve at the level of the wrist. It can cause pain. It causes tingling in the fingers we call this the radial side of the hand, including the thumb. Often symptoms are during the nighttime. They can be very severe. Patients do wake up with pain, and sometimes what helps is shaking the hand. This is a typical story that I hear, that they wake up at night and have to shake their hand better. Initially, carpal tunnel syndrome can be managed with simple measures like splints, but if the symptoms persist for months or years, the best treatment option is a release of the median nerve at the level of the wrist. Yes. So the main symptoms of carpal tunnel syndrome is tingling, numbness, and pain in the hand. Things that we worry about is when you start developing weakness. So if the muscle of the thumb in this area start to waste, and if this becomes weak in certain movements, then this is a real warning sign where surgery is advised. But even with long-standing pain and tingling, as well as numbness, the longer the nerve is compressed, the more likely it is to have permanent damage. As soon as you have persistent symptoms that do interfere with your daily living, with your quality of life, that do wake you up on a regular basis, you should see someone. This might be a physiotherapist to begin with, or a GP, but even if these symptoms persist despite conservative measures, then you should be seeing a hand surgeon. Carpal tunnel syndrome is primarily a clinical diagnosis. So with a typical history and some clinical findings, but we then confirm the diagnosis with a nerve test. It's called a nerve conduction study. So before proceeding to any sort of treatment, all patients should have a nerve conduction test. And if this confirms the diagnosis and the severity of the carpal tunnel syndrome, then we would recommend treatment or surgery. So carpal tunnel syndrome is caused by compression of a nerve at the wrist. So if you leave that nerve compressed for too long, this can lead to permanent damage. So sometimes I see patients that have been waiting too long because they weren't sure about what might be causing this. So this is a normal sign of aging. It is certainly not. But if the nerve is compressed for a long time, and if the compression is severe, then the damage is often irreversible. So it is concerning, especially if we see muscle weakness and wasting of the muscles in the hand. That is usually a late sign and a sign with a less good prognosis. So carpal tunnel syndrome initially is treated conservatively. So that means rest, sometimes anti-inflammatory medication, sometimes some stretching exercises, and some what we call nerve glide exercises. All these measures usually improve the symptoms. Specifically, night splintage seems to help a lot of patients. Now, sometimes these symptoms settle down completely and no further treatment is required. But if symptoms persist or get worse despite these measures, then it is strongly advised to seek specialist advice and to have a nerve test done. If the nerve test shows severe compression of the nerve, then we do recommend surgery.